Hey guys, I'm Kayla Taylor and welcome to Kayla Tailored Wellness. My name is Kayla Taylor and I am a family nurse practitioner that specializes in integrative medicine. So what that means is not only do I get to practice traditional care in the healthcare setting, but I also get to practice holistic care using lifestyle changes, disease prevention, and treating with supplements, herbs, and vitamins. So today I want to discuss headaches and specifically focus on migraines. I want to discuss how they are caused, lifestyle ways to prevent headaches, how I would treat them pharmacologically in the clinic, and natural treatments for headaches. But first, smash that like button and hit the subscribe button for the YouTube algorithm. So just remember, I am not your healthcare provider. I do not know your allergies. I do not know the medications you take. I do not know your past medical history. So use what you learned today to have an educated conversation with your primary care provider. Symptoms of migraines would include unilateral pain on one side of the head. If you feel like there is a band wrapped tightly around your head, that's usually a sign of a tension headache. Migraines will also be associated with photophobia, which is sensitivity to light, phonophobia, which is sensitivity to sound, and nausea and vomiting. There are many causes of migraines, which include sleeping too much or sleeping too little, lack of exercise. They actually recommend aerobic exercise for 30 minutes 3 times a week. High stress, so you might be more inclined to getting migraines when you're at work, and certain foods including chocolate, wine, aged cheeses, nuts, nitrates such as in pepperonis, and caffeine withdrawal. Sometimes caffeine can help on the onset of a migraine because it can cause vasoconstriction and decrease the pain. Changes in weather can cause migraines. Poor vision, so you may want to consider getting a vision exam. Medications such as birth control, genetics, so a family history of getting migraines, and brain tumors. Red flags for headaches include new onset of headaches over the age of 50 years old or changes in the pattern of the headache, fever, weight loss, or fatigue, changes in consciousness or loss of balance, the headache worsens with positional changes, the headache develops suddenly and is very intense. First-line treatment for migraines would include taking Tylenol 1,000 milligrams and Ibuprofen 600 milligrams. So these are great to work together in different ways to control the pain. You want to make sure that you don't take too much of this because it can cause rebound headaches. The next step I would take is Triptans. So that's a prescription for Imitrex or Maxalt. And so those are great at aborting the headaches, but you want to make sure you take them at the onset of the headache instead of chasing after the pain. So if a patient is getting frequent migraines, I may prescribe them a daily medication to prevent the migraines. This would include Topamax, which is an anticonvulsant, Amitriptyline, which is an antidepressant, Propranolol or Verapamil, which are both antihypertensives. It's important to start a headache diary to determine what behaviors are causing these migraines. So you want to track what foods you ate that day, how much sleep you got the night before, your stress levels, your activity levels, and what medications you've been taking that day. Since lack of sleep is a precipitator for getting migraines, you want to make sure you're getting enough sleep, and you can take melatonin or valerian to help you rest. You also need to reduce your stress, so you can do some mindful meditation to help reduce that. You may want to try an elimination diet to remove foods that are triggering the migraines. You can also eat foods high in omega-6 fatty acids such as nuts, seeds, and avocados. Make sure to drink 40 to 60 ounces of water a day, and consider losing weight since obesity does create an inflammatory state causing migraines. You can take riboflavin, which is vitamin B2, 200 milligrams twice a day with meals. It can help prevent migraines and works best if you take it with a beta blocker. You can also try potassium magnesium aspirate 500 to 1,000 milligrams a night to help prevent migraines. Side effects can include diarrhea. Magnesium oxide is easier to find but is not as well absorbed. Additionally, coenzyme Q10 150 to 300 milligrams a day can help prevent headache frequency. Feverfew 125 milligrams a day had a 70% reduction in headache frequency and severity. Butterbur reduces migraine frequency by 50%, so you can take 50 milligrams 3 times a day in the first month and then decrease to twice a day after that. Progressive muscle relaxation focused on breathing exercises and guided imagery can reduce migraines. Treatment is enhanced with a beta blocker. Cognitive behavioral therapy to modify maladaptive thoughts such as self-blame, hopelessness, helplessness can help prevent migraines. Self-hypnosis can reduce headache frequency and decrease the severity of the pain. Mindful meditation will improve the mood, reduce stress, and help control the headache pain. So that's all I have for you guys today. Thanks again for watching. I hope you had some useful information to prevent your headaches. Comment below, let me know if there's been anything else that has helped your migraines. And follow me on Instagram at Kayla Tailored Wellness. In the description below, I do have a link to competitively priced supplements. And thanks again for watching and letting me tailor your wellness.